Welcome to Sexually Charged Radio on 93.3 FM CFRU, or perhaps you're listening on YouTube after searching Sexually Charged. I am Ruthie, and I'm here with two different co-hosts today. They are
Sheila
and
Erin Watson.
Yay! And the three of us will be talking. We're here without Thomas, so anything could happen. I like to go by the pronoun they. How about you, Sheila?
I like to go by the pronoun she and her.
Erin?
I also go by she and her.
Great. Would the two of you like to introduce yourselves? Sheila, I know you've been on before, and you're an important part of editing and making sure that all these programs actually reach people's ears.
Yeah.
You want to tell us about yourself?
Yeah, sure. I am a third-year undergraduate student at our lovely University of Guelph. I also have minors in family and child studies as well as psychology. I am interested in everything sexuality-related, relationships, couple, family-related. So I do call myself a sex nerd, and I'm very excited to always be to be recording with you guys.
Awesome, welcome. Erin, tell us about you.
I'm super excited to be here. First time I've hounded you to be on. So I'm very, very excited to be here. I am a PhD candidate at the university here, and I mostly study sexting right now, or the intersection of sexuality and sexual becoming in a digital culture. But of course, sex nerd as well, interested in anything sexuality, gender related. I'm also a trained psychotherapist and worked in a community setting and am going into private practice soon.
Cool. Thank you. Welcome. And now I feel like I want to ditch our question and just talk about sexting. So that's always an option, too. I'm Ruthie, Dr. Ruth Newstifter. I teach in the Couple and Family Therapy program here at the University of Guelph. And Thomas and I co-chair the Guelph Sexuality Conference. And we have research labs and all kinds of good things going on as well. So, Erin, you received a question from someone who came to just kind of a drop-in sex ed event that Sheila helped put together, that Erin and I helped table for, as far as the Ask a Sex Educator part. And I was wondering if you could describe the question to us.
Yes, this was a really interesting question. A young woman came and asked about some pain that she has in her clitoris. She says it's a constant pain, somewhat described as perhaps a hypersensitivity, and it's just in her clitoris. She says she's had it her whole life, doesn't have pain in urination, did mention a little bit of pain when engaging in penetrative sexual activities. She is with a female partner currently. And it was a really fascinating discussion that we got into about the potential nature or origin of this pain and where to go with it.
So not only am I impressed that somebody went ahead and trusted somebody else with this question, because culturally and socially there's not enough respect for these kinds of concerns, but I'm also wondering what her goal was. Less pain, right? So, or to not have pain, or was there a specific situation she was hoping to make easier in spite of pain?
My impression, she didn't stay long. She brought her partner with her. I think a lot of it was just having a safe space to have her pain acknowledged, validated, and normalized a little bit, feeling that she wasn't maybe the only person in the world who ever had this concern.
Sure.
And then secondary to that was, okay, is there hope that maybe pain could go away, that I could have a sex life that I don't have fear that's involved in it as well? And if that's not the case, I mean, what can I do in the meantime to facilitate pleasurable sexual encounters, knowing that this might be a barrier?
Okay. So people think a lot about, I think a lot about chronic pain. Probably other people don't think a lot about it necessarily. Some do, some don't. But it feels like even for folks who are thinking and talking about chronic pain, it isn't often discussed when it has anything to do with genital regions. And it tends to be discussed as like a mental health thing. When, granted, the brain is in charge of everything, but that doesn't make it a mental health type thing, right? What are you thinking, Sheila, as you hear this?
I know, like, from friends that I've heard when they talk about this, usually when I ask them, oh, like, have you gone to maybe see a physician because it might be a medical thing, they tell me that they usually get brushed off by physicians and saying how, oh, it's, like, all in your head, or, oh, this is just, it's a normal thing, when pain...
It's a menstrual thing,
Yeah.
you're fat, you're complaining, your partner doesn't know how to
haven't had
have
enough
sex
experience.
with you. You haven't had enough experience.
Not using enough lube,
Right.
friction.
And all of those may be possibilities, but that's part of the research of finding out and addressing the issue, not just advice you spit at somebody and then send them away.
Yeah.
And this person isn't even having sex-specific pain. It's general pain.
Yeah.
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 Yeah, so that dismissal is really sadly common. And sometimes I wonder if when a professional doesn't know how to address something, they just say something to make the person go away because they don't know how to address it, which is a sad thought.
And this is not to say that all physicians are like this, of course.
Right.
But,
Too many.
Yeah.
Yeah, and if you have enough bad experiences, you stop asking.
Yeah.
Right? So you might not find that person who is a more mindful professional about it.
Yeah, it can
Yeah.
discourage you easily, too, in thinking. And then from what I've talked to with my friends, sometimes they say, like, well, I guess it's just a me thing. And I just want to tell them, like, no, it's not. Please don't think like that.
And even if it is something that's isolated to a very small group of people, that doesn't make it invalid or something that shouldn't be recognized and appreciated for being problematic and not just, not just something you made up, I guess, or could control easily if you were strong enough or something like that. So when you were talking to this person, how did the conversation go from your side? What kind of ideas did you bring up there?
Well, I mean, the first thing I did, honestly, was admit that I wasn't necessarily an expert in genital or sexual pain, but I was so pleased that she felt safe coming to talk to me about it. I said I don't have necessary statistics on the frequency or occurrence of this, but that if she's experiencing it, it's normal. It's normal for her, and it's a valid concern.
If it's happening, it's natural.
Exactly.
And normal is a really wide range, right?
Yes, yes, absolutely. I tried to use language that maybe would be applicable to how she was describing it to
Totally,
me.
absolutely, totally.
And so I started just with some validation, and then I asked follow-up questions. I didn't want to jump into, oh, well, here's what it might be, or it might be this, or it might be this. That's a lot of information overload. I wanted to know more about when does it manifest, how long has it manifested. And so I got a little bit of kind of a history from her. And then we talked about how, there could be medical origins, there could be neurological origins, there could be psychological, there could be trauma, but the thing is not to pick one just because I've said it.
Right.
I wanted to give her the idea that there are so many things that contribute to our embodied experiences, and mostly I tried to help her with feeling comfortable and confident knowing that there were directions to explore, whether it be speaking with a doctor, speaking with a wellness center, speaking with a sex therapist who could understand how to facilitate more pleasurable experiences, given that this might be a barrier, how to communicate with her partner. So really I tried to keep it kind of open to what made her feel hopeful about moving forward.
Yeah. And maybe then the goal then is increased quality of life, and there could be lots of different ways towards that. And maybe the goal isn't necessarily getting rid of the core problem all the way, because that may or may not be realistic, but improved quality of life, could include getting rid of the issue altogether.
For sure.
Or it could also mean reducing the distress it causes, or learning how to adjust other things to make it get in the way of life a little bit less.
Yeah.
Including sex life,
Yeah, I think sometimes whether the problem is chronic pain or anxiety around sexuality or really anything, I think a lot of us maybe want to just feel that there is a way to move forward, that we have a bit of personal choice and autonomy, that we know where to seek information even if the information isn't going to answer all our questions right away.
Yeah.
And so I kind of wanted to just expand her horizons, validate her experience, and say, there's lots of options. Here are some ideas. Ask her what she thought was the best avenue for her. And then I did actually also provide my information for follow-up in case she had questions, so I could offer referrals, not necessarily medical advice, but referrals.
Right. Some other folks to talk to that maybe you've vetted a bit or have a certain reputation for at least being respectful and taking it seriously and helping to connect people in positive ways.
Yeah.
So this makes me think of times that I've met with friends or with clients or whatnot, and they want to bring up something to a doctor that tends to not be taken seriously, and how to go about doing that and how to kind of bolster yourself for how that will go. So I know, like, I ended up switching my physician a few years ago because I felt that there were things they were not taking seriously. And that's a tremendous amount of privilege to say, first of all, to say that I have a regular physician, and then to say that I can go ahead and jump ship to a different one. And I lucked out because there was a gender clinic, like for trans and non-binary folks and whatnot, just opening at that time that was taking enrollment. So I fit that demographic. Right. So I was able to jump ship like that. And it was a great decision on my part, but I know that most people have who they have, and it's not necessarily even a consistent healthcare provider. It may be the emergency room staff you have when things are so bad that you go in, or it may be the walk-in center people, or whatever the case may be. So there's lots of things to think about with trying to navigate those conversations, and I've gone in with so many friends and loved ones and family members to their doctors because they just want somebody else there that they hope that maybe if there's two people in the room, the doctor will take the thing seriously. And I've certainly had experiences that were better than that, right? But these stand out. And I feel like lots of people have had that. Have you run into that, or any of your peers run into that before?
I have had that experience. It wasn't related to a sexuality issue, this particular incident, but the fact that I brought my aunt along with me enabled me to better speak up and advocate for myself, because at the time I was younger. I didn't know I could speak to an authority person if I felt they weren't hearing me.
Sure.
Or oftentimes I think, because of the time constraints around medical appointments, it's like, okay, I think I got the gist of what you're saying, and let's offer some solutions. And it was nice to have another person there who said, hold on, just a minute. I know this person. I know that that's not what's going on. Can you just listen to this piece?
Yeah.
And that was someone who had a voice that I didn't feel that I could have had in that moment.
Yes. Yeah, it is difficult because even if all the social demographics are equal somehow, you still have a person who's controlling your access to prescriptions, controlling your access to referrals, writing secretive things about you somewhere that you don't really get to see. If you are utilizing any kind of health insurance, then how they file it and if they do the record filing in a timely manner will determine the nature of the giant bills you receive later. There's all kinds of power stuff going on there. Plus, an age difference or a gender difference or an ethnicity difference or a sexuality difference or anything like that.
Yeah.
You look thoughtful, Sheila.
I'm just taking in all this. I just love the conversation going around me. Nothing really stands out to me with that type of experience. The only thing I can think of is just being bounced around different doctors when they don't really know what's going on. They're like, try these three other people. Woo! And then they take forever to call back. But I feel that's a little unrelated. But again, I feel very privileged as well to have access to many doctors at one time as well. As well as I've had experiences where bringing, like, for example, my mother with me actually hindered, or is that the right word? I didn't enjoy that experience because the doctor was trying to speak to me and she was trying to jump in and be like, no, that's not good. And so a little bit of self-disclosure is that I have polycystic ovarian syndrome and I need to take birth control just to help regulate all my internal stuffy stuff. And my mom is coming from that, we don't need medication, didn't want me there, and then that made the doctor feel a bit awkward. So
what's going on there? Yeah.
So kind of going off of Erin's part, it's like sometimes I find that having another person can help, and other times it can't. It just depends on the person.
Yeah, it sounds like being able in advance to know who the best support ally or advocate could be. For this particular individual, she brought her partner with her, and her partner was a stayed silent but supportive individual who let her have a voice and let her tell her story.
Yeah.
And certainly, you know, me working as a therapist, there are times where I know a partner comes in to support, but support is not what happens. It's intervention, it's negating, or so you raise a really good point about, you know, are the supports we're bringing in actually there to facilitate our narrative.
And will they give us the autonomy that we deserve and have a right to as well? And at that time I was thinking, I was 17, 18. Like, I'm fully competent, capable of handling these things. So, you know, it's just something you learn for the future. And I've had, there's been times I've had to go to the emergency, and I had a friend with me who knew like all the medications I was on and who let me make all the decisions when they asked if I wanted to do this and this. And it's a complete different experience, right? So I definitely agree. It really depends on who you have as your support system.
Yeah, absolutely, absolutely. Just to break in and remind people that we're listening to Sexually Charged Radio, 93.3 FM, CFRU, if you are in the Guelph, Ontario area, or perhaps you're streaming online through CFRU's website, or you have searched Sexually Charged on YouTube and you might be listening to us there. If folks have a question that they want to send in and we can discuss that topic or question, it's AskSC, the initials for Sexually Charged, at uoguelph.ca, uoguelph.ca. And the wonderful students at Student Wellness, Sheila and others, will receive those questions and can move some of them forward to us. So as we were talking, I was thinking two thoughts. One of them is when I work with clients and stuff to figure out how to approach a healthcare practitioner about something that's difficult. And the other thought, which is sort of related, is just recognizing physicians and other healthcare professionals as people. And I do mean that we should have compassion, but that wasn't actually what I was thinking of. I was thinking more that this is a group that's under the same types of biases and stigmas as the rest of society. And so we perhaps want to think of them as neutral or progressive, but they are, I assume, somewhat representational of the larger populations from which they come from, meaning that, you know, if a certain number of people are likely to not take genital pain in assigned female at birth folks seriously to begin with, there'll probably be some physicians that don't take that seriously too, because they were at one point members of the general population, right? But I'm thinking, you know, when I coach folks on how to find a therapist for them, so let's say it's a friend or a family member of mine, they can't come talk to me, that would be a conflict of interest, and it wouldn't work as well anyway, because we have a pre-existing relationship of a different nature. So if they are looking for a therapist who can work with them on something specific, I'll often encourage them to say, you know, this is the general nature of what I want to discuss. Are you a person who can help me with this, or can you direct me to someone who can? Which is really different from saying, this is the problem, what should I do?
I really like that.
Because one of them assumes that somebody knows, and the other gives people an opportunity to have an out while still respecting their expertise in other areas. And I don't know that would always work super well with everybody even, or with anyone, but I think about times that I've been to physicians and I've suspected that they probably, once they started talking, didn't actually connect with what I was saying, or maybe it was outside of their scope of expertise, and I had wished I had asked them if they could before I asked them what to do. I don't know what kind of difference that had made. I don't know. What are your thoughts when you work with people in those sorts of directions or coach them?
I really like the way you phrased it. I'm going to adopt that from now on for sure. I definitely take the approach of, you know, you can ask me anything, you can say anything, and I will listen non-judgmentally, but I believe you're the expert in your own story, your own body. And if I don't have answers, I'm going to support you in finding the appropriate people or tools for those answers, but I'm not going to necessarily sit here and pretend I know what's going on. So I approach it similarly in the sense that right up front, I acknowledge my own limitations and scope of reference and information. And I think it's not to terrify the person into thinking, oh no, where am I going to find answers? But I just think there's so much value in saying, okay, here's what I can offer, and if I can't offer ideas or solutions or information, I can offer a grounding point that you can use to find the appropriate information.
Right.
And the reason I think that's important is because I think about our experience here at the University of Guelph, where we have a medical center, and you book an appointment with a physician, it's going to be a different one each time.
Right.
Yeah.
Or if you go in and you have bad headaches and they're not the headache expert, you're going to be recommended to see someone else. And it's nice that we have that at our disposal, but you get lost in the
Ping ponging?
yes, that's
Yeah.
a very good way of saying it. You're bounced around and then you can't remember where you started. And so what I like to do is I say I will continue to be this kind of like grounding origin point that you can maintain my contact information, you can update me about what's going on, but you always know that there's sort of like a center or a home that you can come back to, so you don't feel like you're being bounced around everywhere.
Drift everywhere. Yeah, absolutely. Absolutely. Yeah, because that is tough, and the moving between folks who might all be great experts and specialists in different areas. They might be great people to consult. You can get different perspectives and things like that. But then it is hard to keep track of it all. It's hard because there's nothing linear happening. So how do you make like how do you make the story out of this when everything is kind of happening in a jumble? How do you keep it in a straight line and kind of recognize which direction you're trying to go in? How things tie together, and also remembering to like update the next professional on what the last professional talked to you about, because they might not have had time to write or review notes very fully.
Yeah, absolutely.
Healthcare is hard from both perspectives, because I'm thinking the professionals too are like, oh, somebody else worked with them, but I'm picking up, you know, if this file with this person, and like it's a project to try to figure out what's going on with any, kind of picking up this project partially done, and then I'm going to hand it off to someone else all the time. Difficult from both perspectives, for sure.
Or even if like the other physician professional made a mistake, and that goes into the next professional physician's hand. So they need to redo the things, and then sometimes the client might see that, oh, this doctor's making me do more things, when really it's just to help the client out, right?
Or do the same things over and over. Like,
been there,
we've
done
gone
that.
through this, why do we have to, especially when, like you said earlier, you know, appointments are limited, they're time limited, and sometimes I think the value in meeting with a physician or anyone in health or mental health field is you just want to have uninterrupted space to say what's happening without a bunch of people saying, have you tried this, have you tried this, have you tried this?
Yes. Yeah, and it's difficult in so many directions. So I'm also thinking about how for some medical professionals across lots of different fields, it doesn't exist until it shows up on a test or evaluation of some sort, which can make it hard to be disclosing things like the original question that we talked about, which may or may not show up on any kind of exam or scan or blood draw or anything like that. And how that can get translated by the professional you're speaking to if they're saying, well, this doesn't really exist because we can't find it, and how dismissive that is when they're saying it doesn't exist within my testing system, but perhaps that wasn't the best way to say it. And the other person's like, well, what am I supposed to do now? Because I don't show up on your test, you don't think I'm real. And the thing is still happening, you know, or the thing still happened, and I'm worried it will happen again.
And then you add in the complication too, especially when we're talking about pain. The way we measure pain is very archaic. I mean, the pain scale is
The little smiley face?
the little smiley faces.
I saw a good one online recently.
Really?
I saved it. Well, I don't know if it's that good. I saw one that exceeded my expectations for typical pain scales online recently.
That's lovely.
I'm going to put it for you. So it's a 1 to 10, and 10 is the worst. 10 is unable to move, but then it gives you description. I'm in bed and can't move due to my pain. I need someone to take me to the emergency room to get help for my pain. 9 is severe. My pain is all I can think about. I can barely talk or move because of the pain. 8 is intense. My pain is so severe that it's hard to think of anything else. Talking and listening are difficult. And then all the way through, well, maybe I'll take it down to 4 or something. 7 is unmanageable. I'm in pain all the time. It keeps me from doing most activities. 6 is distressing. I think about my pain all the time. I give up on many activities because of my pain. 5 is distracting. I think about my pain most of the time. I cannot do some of the activities I need to do each day because of the pain. And then so on and so forth down to 0. I have no pain. Does that, how does that feel to you? It's still very subjective.
It's still very subjective, though I really appreciated that it had descriptions. And I think the value in that is also being able to say, in my day-to-day existence, I might be at a 4, but as soon as I try and engage in a certain activity, it does go up to this number. Because that way, when you're talking to someone, they're not saying, oh, well, you said your clitoral pain is a 4, so 4 is below 5, it's fairly low on the scale, it's maybe not intrusive to your life. But on the other hand, unless the clit is rubbing against any clothing in any way at all times, or perhaps skin folds.
Or you just want to masturbate.
That's just it. So
yeah.
There are circumstances where the pain number is going to be particularly relevant.
Yes. Yeah, and I'm also thinking of how used to pain people are. So, people will say things to me like, did my tattoo hurt? And I'm like, yeah, I'm like, ooh, how did you sit through all the pain? I'm like, well, I get migraines. So to a certain extent, I'm practiced at breathing through pain and recognizing that pain will last for a long time. And I don't expect myself to think clearly, and I don't expect myself to feel okay until it's gone, because I'm used to it. Right, but but that doesn't mean that it hurt less. It meant that I'm more used to it, or maybe I was less afraid.
Maybe even a higher tolerance to it.
Sure. Or I've just developed some mindfulness and grounding tools that get me through the time period.
Yes.
And then I think, okay, what if someone had never dealt with a long-term pain kind of thing before? They might receive this as different or more frightening, or not have the same kinds of tools, but then that would disadvantage me when speaking to a professional about a pain thing, because I might say, well, I can do more activities because I'm used to teaching a 3-hour lecture when I have like a 50% of 50% or less bad migraine. Like 100% is the worst one I've ever had, right? Like if I'm at 50% or below, I can teach through a class, but I'm really not there, you know?
Yeah, and you know what, Ruth, you raise a really good point, and that is that sometimes when we don't have, immediate solutions to remove pain, we try and, work through it, and we go, okay, well, this might be something that you have to live with. But in that, do we then take hope away from someone by saying, oh, I guess we'll just develop better coping strategies, which can be very disheartening, because nobody should have to live with pain.
Absolutely. And that is the best possible note I can think of to wrap this up on. Thank you so much, Erin and Sheila. I really appreciate this conversation on chronic pain and dealing with medical professionals. So thank you so much. You've been listening to Sexually Charged on CFRU.